9 popular medications that can trigger rapid dementia. In our country, every 66 seconds, another senior receives the heartbreaking news that they have dementia. By the time you finish reading this text, 20 more families will have been confronted with those very same words. And for some of these families, the cause wasn't simply the natural process of aging. It was something far more insidious. A bottle sitting innocently on their bathroom shelf. A medication they were assured was completely safe. A trusted part of their daily routine. I am Dr. John Myers, and with 15 years of dedicated medical practice, I have witnessed this exact painful scenario unfold more times than I can possibly count. I've seen vibrant individuals, sharp and astute their entire lives, begin to slowly, subtly lose their grasp on reality. They start forgetting names of loved ones, missing important appointments, getting lost on a drive home they've navigated thousands of times before. And tragically, almost everyone around them, including sometimes even their doctors, dismisses these worrying signs as just getting old. But often it wasn't old age at all. It was a medication. A single pill or a combination of them that almost nobody bothers to question. Why? Because a doctor prescribed it and a reputable pharmacy filled it, implying it must be perfectly safe. However, the latest groundbreaking research continues to reveal a different, more alarming truth. There is a specific class of common, everyday drugs that can dramatically diminish your memory and learning abilities within just a single year. What's truly shocking is that the vast majority of people taking these medications have absolutely no idea what's happening to them or the silent toll it's taking on their minds. Today, I want to guide you through the 9 specific medications most strongly linked to rapid memory loss and cognitive decline. We'll count them down starting from the ones that are often quietly overlooked, right down to the one I personally consider the most destructive and impactful of all. Pay very close attention as we reach number 3. This particular medication is prescribed to millions of older adults for something that sounds utterly harmless, yet it could be silently shrinking the vital memory centers of your brain right now without a single obvious warning sign. Before we dive into the details, I genuinely appreciate it if you could share in the comments below. How old are you, and which medications do you take on a daily basis? I personally read every single comment, and understanding the age and medication profiles of this audience truly helps me shape the topics I cover next, ensuring they are most relevant and helpful to you. Let's begin our crucial countdown. Let's start our list with the 9th medication, and please don't let its low spot on this list make you underestimate its potential impact. This particular drug can be found in almost every single medicine cabinet across America. Number 9 is diphenhydramine. You likely know it much better by its common drugstore brand name, Benadryl. This is that familiar little pink pill that countless people reach for when they want to fall asleep, or to calm down an irritating allergy attack, or simply to alleviate the nagging symptoms of a common cold. It costs very little, just a few dollars, and it's readily available on open shelves in pharmacies everywhere. Because no prescription is needed, most people simply assume that it must be a gentle, harmless remedy. But beneath that gentle facade, inside the complex machinery of your brain, diphenhydramine is doing something far from gentle. Benadryl belongs to a broad category of drugs known as anticholinergics. While anticholinergics sounds like a complicated medical term, the underlying concept is quite simple. These drugs actively block a crucial brain chemical called acetylcholine. Acetylcholine acts as the primary messenger your brain uses to form new memories and to maintain alertness and focus throughout your day. As we age, our brains naturally produce less of this vital chemical, meaning they become more reliant on every bit they have left. So, when a drug comes along and actively blocks acetylcholine, its impact on a 70-year-old brain is far more pronounced and damaging than it would be on a 30-year-old brain. The specific area of the brain that bears the brunt of this impact is the hippocampus. This small, fascinating, seahorse-shaped structure is where all new memories are initially formed before they are properly filed away for long-term storage. In my years of practice, I've observed numerous patients who have taken a nightly antihistamine, often Benadryl, for years on end. They slowly, imperceptibly start to lose their mental sharpness, their clarity, and not once do they ever connect that increasing mental fog to the innocent-looking pink pill sitting right by their bedside. Yet, the scientific research connects these dots quite plainly and unequivocally. A significant paper published in 2023 in the Journal of Geriatric Cognitive Health closely monitored a group of older adults who regularly used anticholinergic drugs. The findings were stark. These individuals had a staggering 54% higher risk of developing dementia compared to those who avoided such medications. This represents more than half again the normal risk, all stemming from something most of us treat as casually as candy. So what steps can you take? First, make it a habit to carefully read the label on any medication you take for sleep or anything marked PM, nighttime, or allergy relief. These products are very often just diphenhydramine, Benadryl, disguised under a different name. If you rely on it for allergies, please know there are newer, safer antihistamines available, such as loratadine, which is sold under the brand name Claritin. These newer options do not cross into the brain in the same way Benadryl does, making them significantly safer for long-term use and your cognitive health. Please, never stop any medication on your own without consulting a healthcare professional. Bring these concerns to your doctor. But crucially, stop assuming that just because something is available over the counter, it is automatically safe for your precious memory. That covers number 9. Moving on to our 8th medication, this is one that your stomach might love, finding great relief from its symptoms, but your brain could be quietly paying a hidden price. Number 8 on our list is the class of drugs known as proton pump inhibitors, or PPIs. The most widely recognized brand names in this category include omeprazole, sold as Prilosec, and esomeprazole, marketed as Nexium. These powerful medications work by effectively shutting down the production of acid in your stomach. They are routinely prescribed for common issues like persistent heartburn, acid reflux, and that uncomfortable burning sensation many experience after meals. People often stay on these drugs for years, sometimes even for decades, because the moment they try to stop, their uncomfortable symptoms tend to roar back with a vengeance. This creates a strong, yet often misleading feeling that the drug is the only thing keeping their symptoms at bay. However, here's a crucial piece of information that almost nobody hears when they pick up their prescription at the pharmacy counter. Your stomach actually needs acid to effectively extract certain vital nutrients from the food you eat. Chief among these essential nutrients is vitamin B12, which plays a critical role in protecting the delicate wiring of your nerves and, most importantly, your brain. If you suppress stomach acid production significantly and for an extended period, your levels of B12 will quietly but surely begin to drop. The same goes for magnesium and calcium, 2 other crucial minerals that your brain cells absolutely depend on to fire and signal cleanly and efficiently. When you starve your neurons of these essential elements, you start to experience misfires, episodes of confusion, and memory slips that can look disturbingly similar to the early signs of Alzheimer's disease. Yet the real culprit isn't nascent dementia. It's a nutrient deficiency caused by the very medication you've been taking all along. The evidence is compelling. A large-scale study published in JAMA Neurology in 2016 meticulously examined over 73,000 individuals aged 75 and older. The findings were striking. Those who were regular users of PPIs had a significantly higher, specifically a 44% increased risk of developing dementia compared to their counterparts who did not take these medications. And the problem extends beyond just nutrient deficiencies. PPIs have also been shown in some research to increase levels of amyloid beta in the brain, which is the notorious sticky protein that accumulates and forms plaques characteristic of Alzheimer's disease. So, what's the recommended course of action? If you are taking a PPI every single day, this is an absolutely essential conversation you need to have with your doctor. Many individuals can successfully and safely taper down their dosage or switch to a gentler class of medications called H2 blockers. A common example is famotidine, sold as Pepcid, which is far less likely to impact your cognitive function. For natural relief, consider chewing deglycyrrhizated licorice, DGL, a natural compound known for its ability to coat and soothe the stomach lining, easing symptoms with absolutely no negative impact on your brain. The ultimate goal should always be to use the lowest effective dose for the shortest necessary time, not to take a pill indefinitely out of sheer habit. That's the story for number 8. Our 7th medication addresses a problem that most people would understandably prefer not to discuss openly, yet it's a widespread concern for many older adults. Number 7 on our list comprises the bladder drugs, and the specific one you should be aware of by name is oxybutynin, commonly sold under the brand name Ditropan. This medication is frequently prescribed to seniors who experience a sudden, urgent, and often unpredictable need to rush to the bathroom. It's the kind of overactive bladder issue that can significantly disrupt and even reshape an entire day, making social activities or even simple outings incredibly challenging. The relief these drugs provide is genuinely real, and the embarrassment and anxiety they spare people are also very tangible benefits. However, there's a significant trade-off. Oxybutynin works by directly blocking acetylcholine, which, as we discussed with Benadryl, is the very same crucial memory chemical. What makes oxybutynin particularly concerning is its ease in crossing the blood-brain barrier and settling directly into the parts of the brain where new memories are actively formed. This characteristic makes it one of the more potentially dangerous drugs on this entire list for older adults, especially when taken consistently, month after month and year after year. In 2019, the prestigious British Medical Journal published a critical study that followed individuals over the age of 65 who had been taking strong anticholinergic drugs like oxybutynin for more than a year. The results were alarming. Their risk of developing dementia was a staggering 49% higher, which is almost a 1 in 2 chance. What troubles me most about these findings is that almost none of these patients were ever warned about this potential cognitive risk. They were simply told that a pill would calm their bladder. Nobody mentioned that it might simultaneously be dimming their mind. The mental fog that slowly sets in often gets attributed to age. People describe forgetting appointments, misplacing their keys 10 times a day, or losing the thread of a simple conversation. And everyone around them, unfortunately, often nods and says, "Well, you're just getting older." It is very rarely traced back to the prescribed medication until a significant amount of cognitive ground has already been lost. If you are currently taking oxybutynin and have started to notice your memory slipping, please take that observation very seriously. It's important to understand that you absolutely do not have to choose between managing your bladder and preserving your brain. Newer medications exist, such as mirabegron, sold as Myrbetriq, which work through a completely different biological pathway and do not block acetylcholine at all. Most older adults, these newer options can provide the same level of bladder control with significantly less risk to their cognitive function. Make sure to bring this up with your doctor at your very next visit. That's our discussion for number 7. The 6th medication on our list might genuinely be the most surprising one here, primarily because it is one of the most widely prescribed drugs across the globe. Number 6 refers to statins. Medications like simvastatin and atorvastatin, commonly known by their brand names Zocor and Lipitor respectively, are among the world's most frequently prescribed medicines, particularly for individuals over the age of 60. They perform an incredibly important function by effectively lowering cholesterol levels and, in doing so, significantly reducing the risk of heart attacks and strokes. There's no doubt that statins play a vital role in the health and well-being of many people, and this discussion is certainly not an argument against their use in appropriate cases. What follows, however, is the often overlooked half of the story, the part that usually gets left out of the conversation. Cholesterol does far more than just influence your heart health. Your brain, remarkably, is composed of almost 60% fat, and it critically uses cholesterol to build the myelin sheath. This myelin sheath is the essential insulating layer wrapped around every single nerve cell in your brain and body, ensuring that signals travel quickly, efficiently, and cleanly. If you lower cholesterol levels too aggressively with a strong enough statin, you can inadvertently deprive the brain of a fundamental raw material that it actually needs to function optimally. The statins that tend to cause the most cognitive trouble are those that can easily cross the blood-brain barrier and enter brain tissue. A 2023 study published in Frontiers in Aging Neuroscience investigated this phenomenon, finding that adults over the age of 70 who had been taking statins for more than 3 years exhibited a 26% higher rate of mild cognitive impairment. Furthermore, the study noted a clear dose-response relationship. The higher the dose of the statin, the steeper the cognitive decline observed. Some patients recounted frightening experiences, such as familiar names vanishing from their memory, entire conversations they had just finished being completely erased, or a driving route they had used for 2 decades suddenly becoming utterly unfamiliar. It's crucial to understand that not all statins affect the brain in the same way. Specific statins like pravastatin and rosuvastatin do not cross into brain tissue as readily as others. Because of this, they are generally considered safer choices for preserving cognitive function. So if you've been on a statin for several years and have started to notice mental fog, increased forgetfulness, or a creeping sense of confusion, that is an absolutely valid and important conversation to have with your doctor. It might be time to discuss a lower dose or a potential switch to a different type of statin. This is not, however, a reason to abruptly and quietly stop taking a medication that may very well be protecting your heart from serious conditions. The goal is to establish the right plan with professional medical help, never on your own. That sums up number 6. Let's move on to our 5th medication. Number 5 on our list includes the class of drugs known as benzodiazepines. These powerful medications, such as lorazepam, sold as Ativan, diazepam, known as Valium, and alprazolam, marketed as Xanax, are among the most frequently prescribed drugs in America, primarily for treating anxiety and aiding sleep. They achieve their effects by boosting the activity of GABA, which is the brain's own natural calming signal. This effectively turns down a racing, overstimulated nervous system, providing much needed relief. Initially, taking a benzodiazepine can feel like a genuine rescue. The intense panic subsides, the incessant spinning thoughts quiet down, and sleep, which had been so elusive, finally arrives. However, over time, the picture often changes dramatically. A significant 2022 study published in the British Medical Journal followed over 8,000 seniors for a period of 6 years. Their findings were stark. Those who used benzodiazepines for longer than 3 months had a striking 51% higher risk of developing Alzheimer's disease. The longer-acting benzodiazepines, such as diazepam, proved to be even more problematic. This is because they tend to linger in the body for extended periods and accumulate in fatty tissues, including, critically, the brain itself. What these drugs are essentially doing is causing a slow chemical sedation of the entire brain. The brain becomes slower at learning new information, and it loses its natural flexibility. Many individuals describe a pervasive sense of flatness, a feeling of moving through a thick fog, of not quite being themselves anymore. The cruelest aspect of these medications often comes during the withdrawal phase. If someone stops taking a benzodiazepine abruptly, the anxiety and insomnia often return with twice the intensity, frequently accompanied by agitation that can be genuinely dangerous. This rebound effect can make the pill feel absolutely essential, ironically, at the very time it might be causing the most harm. Therefore, here is a vital rule, and it truly matters. If you have been taking a benzodiazepine for more than just a few weeks, it is critically important not to stop suddenly on your own, as this can lead to life-threatening withdrawal symptoms. Instead, it is imperative to work closely with the doctor to gradually taper down the dose slowly and safely over several weeks or even months. Gentler, safer options are available for anxiety, such as buspirone, which does not induce sedation or cloud the mind. Additionally, specific forms of talk therapy, particularly cognitive behavioral therapy, CBT, tailored for insomnia and anxiety, can effectively bring calm back without the significant cognitive costs. That's the crucial information for number 5. Our fourth medication is a single pill prescribed for 3 distinctly different problems, and it carries one of the heaviest yet most hidden burdens of all on cognitive health. Number 4 on our list is amitriptyline, widely known by its brand name, Elavil. This is an older class of antidepressant that, remarkably, is still frequently prescribed today, not just for depression, but also for nerve pain, to aid sleep, and even to preemptively prevent migraines. This very versatility, its reputation as a do-everything pill, is precisely why it spread so quietly into medicine cabinets everywhere. However, beneath its seemingly versatile facade, amitriptyline is, in reality, one of the most potent anticholinergic drugs still in widespread use. This means it aggressively blocks acetylcholine, that same crucial chemical your neurons absolutely need to communicate effectively with each other and to firmly lock in new memories. It blocks this chemical so powerfully that with long-term use, the effect on memory stops being a rare or occasional side effect and instead becomes an almost expected, unavoidable result. A large and impactful study published in 2015 in JAMA Internal Medicine followed more than 3,400 adults aged 65 and older. The findings were very clear. Those individuals who had the highest cumulative dose of anticholinergic drugs, such as amitriptyline, over a 10-year period had a significantly increased chance of developing dementia, specifically a 54% greater risk. And what's particularly troubling is that almost none of them were ever informed that this seemingly innocuous pill could have such a profound and detrimental effect on their cognitive function. They were given it for sleep or for pain, and then slowly, over time, they began to notice words going missing from their vocabulary, their memory thinning, their concentration fraying, and tragically, they attributed it all to the inevitable process of aging. It doesn't even take a high dose to cause damage. A small nightly dose, taken consistently for years, can quietly and insidiously erode brain power with no obvious symptoms until the cognitive loss is already substantial and real. If you or someone you care about is currently taking amitriptyline, this is a conversation that is absolutely worth having with a doctor very soon. For nerve pain, alternative options such as duloxetine or gabapentin can often provide similar relief without carrying the same heavy anticholinergic burden on the brain. For sleep, safer alternatives like melatonin or a very low dose of doxepin, which is far gentler on the acetylcholine system, can often take its place effectively. And for mood support, newer antidepressants such as sertraline or escitalopram are generally considered much safer choices for the long term health and vitality of the brain. That completes our discussion on number 4. Now we arrive at number 3 on our list, the one I specifically asked you to pay close attention to. This medication is given to millions of people for something that, on the surface, sounds entirely harmless. Number 3 is paroxetine, most commonly known by its brand name Paxil. This drug is one of the most frequently prescribed members of a family of antidepressants known as SSRIs, widely used to treat both depression and anxiety. On the surface, it appears to be a modern, gentle option, seemingly kinder and with fewer side effects than many older psychiatric drugs. However, here is a crucial detail that is very rarely mentioned. Paroxetine stands out as the only SSRI that possesses strong anticholinergic activity. This singular fact fundamentally differentiates it from its close relatives, like sertraline and escitalopram. Because of this, paroxetine reaches into and disrupts the very same acetylcholine system that every other problematic drug on this list has been quietly chipping away at. In 2021, a comprehensive review published in Frontiers in Psychiatry meticulously examined older adults who were taking different types of SSRIs. The review found that users of paroxetine showed measurable and significant drops in their short-term memory, their ability to recall words, and their overall attention span, all within the first 12 months of starting the medication. Even more concerning, seniors taking paroxetine were 30% more likely to exhibit early signs of cognitive impairment compared to those taking other types of antidepressants. There's a profound irony in this, as the drug is often prescribed to stabilize and steady the mind, yet over time, it can inadvertently wear down the very mental clarity and sharpness it was initially intended to protect. The solution here is quite clear. For older adults, paroxetine is unequivocally a medication to avoid. The esteemed American Geriatric Society has actually placed it on something called the Beers List. This is a formal, authoritative catalog of drugs that are considered potentially risky or inappropriate for seniors. And paroxetine is included on this list for precisely these reasons, its cognitive side effects. If you are currently taking paroxetine, it is vital to ask your doctor about the possibility of switching to a safer SSRI, such as sertraline or escitalopram. These alternatives are generally much gentler on the brain and do not carry the same significant cognitive risks. Additionally, supporting your B vitamins, especially B12 and B6, can often help naturally stabilize mood alongside such medication changes. That concludes our examination of number 3. We're almost at the top of our list. Number 2 is prescribed so quietly and often so subtly that many people taking it have absolutely no idea what kind of drug they are even consuming. Number 2 refers to the class of medications known as antipsychotics. And honestly, this particular one disturbs me the most because a significant number of individuals who are taking these drugs never actually consented to taking an antipsychotic in the first place. The common names you might encounter include quetiapine, sold as Seroquel, risperidone, marketed as Risperdal, and olanzapine, known as Zyprexa. These powerful drugs were originally developed and approved for the treatment of serious psychiatric illnesses, such as schizophrenia and bipolar disorder. However, today they are increasingly being handed out off-label to older adults. They are prescribed for a variety of less severe issues to help with sleep, to calm mild restlessness, or to manage the agitation that can unfortunately accompany dementia itself. Essentially, these incredibly potent drugs designed for severe mental illness are now being used in homes and nursing facilities on seniors who are simply confused, restless, or perhaps just challenging for an understaffed or busy care team to manage. The human cost of this practice is incredibly steep. A 2022 study published in Lancet Healthy Longevity meticulously followed over 25,000 older adults. It revealed that those who were given antipsychotics for behavioral symptoms were a staggering 71% more likely to experience worsening cognitive decline within just 1 year, even if they had no prior history of dementia before starting the medication. Furthermore, these same drugs also significantly elevate the risk of stroke, of sudden cardiac death, and of profound sedation that can lead to dangerous falls and extended hospital stays. These medications work by suppressing dopamine, a critical brain chemical tied not only to mood, but also to essential functions like focus, planning, and memory. When dopamine levels are suppressed sufficiently, the brain slows down and becomes unresponsive. This is precisely why individuals on these drugs can often appear dull, flat, almost absent, causing their families to grieve for someone who is physically still sitting right in front of them, but mentally seems to have vanished. If you or a loved one is currently on one of these antipsychotic medications, the very first and most crucial step is to ask the prescribing doctor a direct and unambiguous question. Why was this medication started, and is it truly necessary, or is it being used for convenience? The truth is, most behavioral symptoms in older adults can often be eased or even resolved without the need for any drug at all. This can be achieved through consistent daily routines, reducing noise and overstimulation, effectively treating any hidden pain, and ensuring proper light exposure and healthy sleep patterns. When medication truly is needed, using the lowest effective dose for the shortest possible time is paramount to minimizing harm. Far too often, families are never fully informed about what these drugs do to the brain, and they witness a decline that they mistakenly attribute to normal aging, when the underlying cause is in fact purely chemical. That's the unsettling truth about number 2. And now we reach number 1. This isn't a single drug at all, but it may very well be the single biggest hidden driver behind almost every single story of cognitive decline I've just shared with you. Number 1 is anticholinergic polypharmacy. This is a pervasive danger that almost nobody names, and it could be one of the largest, yet least recognized causes of drug-induced memory loss in older adults today. You were probably expecting one final villain, one single worst pill to be at the top of this list. But the real worst-case scenario is far more subtle and insidious. It's the slow, cumulative, and often unrecognized stacking effect of taking several anticholinergic drugs simultaneously, with absolutely nobody adding up the combined total impact. Polypharmacy simply means taking many medications at once. Anticholinergic burden, then, refers to the combined weight, the aggregated effect of all these different drugs working together to block that one crucial memory chemical, acetylcholine. Picture a very common yet alarming situation. A senior takes Benadryl every night to help them sleep. In the morning, they take oxybutynin every day to manage their bladder issues. And then, for persistent nerve pain, they also take amitriptyline. On its own, each of these medications might cause only a small, barely noticeable dip in cognitive function. But when taken together, their effects compound dramatically, and the total burden on the brain climbs rapidly and dangerously. A compelling 2022 study published in Age and Aging meticulously tracked over 280,000 older adults. The findings were undeniable. Those individuals with the highest anticholinergic burden had a staggering 120% higher risk of developing dementia within a 10-year period. That's more than double the risk. And perhaps the most shocking revelation was that the vast majority of these individuals had no idea whatsoever that they were even taking anticholinergic drugs. No one had ever properly explained it to them. When you block acetylcholine from several different directions at once, the brain doesn't just quietly idle. Its neurons actually start to wither from disuse, vital connections shrink, and the brain settles into a quiet, underpowered, and compromised state that can look almost identical to Alzheimer's disease during cognitive testing. However, here is the incredibly hopeful part of this message, and it is precisely the reason I felt it was so crucial to make this video. Drug-induced cognitive decline is very often reversible, especially when it is caught early enough. If you can lift this heavy anticholinergic burden, many people experience a remarkable return of their mental clarity, their energy levels, and their memory, often within a matter of weeks or a few months. The human brain is far more resilient and capable of recovery than we often give it credit for, but only if you identify and remove what is actively harming it. The solution to this problem doesn't require a miracle. What it requires is a careful, thorough, and informed medication review. I urge you to sit down with your doctor or your pharmacist and have them meticulously go through every single prescription you take, every over-the-counter pill, and every supplement. Ask them to add up your total anticholinergic load. There are simple, readily available scoring tools that can do exactly that. Once the problematic drugs are identified, you can safely taper off what you genuinely don't need, switch to safer alternative options where appropriate, and most importantly, give your brain the crucial room it needs to recover and heal. This issue, anticholinergic polypharmacy, represents the most preventable threat to the aging mind on this entire list, and that is precisely why it sits at number 1. Now, I truly want to hear from you. Of these 9 categories of medications, which ones are currently in your medicine cabinet? Have you noticed any brain fog or increased forgetfulness creeping in after you started taking something new? Please share your experiences below in the comments, and crucially, tell me that you will ask for a comprehensive medication review this week. Your honest answer might be the very thing that saves the next person who reads it. And before you go, there's one more place your body hides its vital warnings. Your medicine cabinet is one, but your hands are another. Believe it or not, your fingernails can actually flag potential trouble in your kidneys, your blood, and even your nervous system, years before any other obvious symptoms might appear. Most people, understandably, never know what specific signs to look for. That will be the subject of our very next video. I'll show you the 4 crucial nail signs worth checking tonight. I'm Dr. John Myers. Stay sharp, and I'll see you there.